Hi, this is Hilary Simon, Colorectal Research Fellow at Columbia University Medical Center in New York. I have nothing to disclose. Today, I present National Disparities in Use of Minimally Invasive Surgery for Rectal Cancer in the Elderly, a National Cancer Database Study. Despite established benefits, MIS may be underutilized in rectal cancer surgery. Factors associated with underutilization are multifactorial, including advanced age. As the elderly are the fastest growing and largest surgical population, further investigation on the disparities that may impact access to MIS in this cohort is warranted. Our goal is to investigate disparities that affect utilization and access to MIS in elderly patients with rectal cancer in the United States. The NCBD was reviewed for elderly patients defined 65 years and older who underwent curative resection for rectal adenocarcinoma and were not treated with chemoradiation from 2010 to 2016. Cases were stratified by surgical approach, open or MIS, which included laparoscopic or robotic. Univariate analysis compared patient and provider demographics across surgical platforms. Multivariate analysis investigated variables associated with MIS use. The main outcome measures were utilization of open and MIS approaches over the study period and factors associated with MIS in the elderly. Over 73,000 rectal cancer patients were identified. 6,817 were elderly, did not have chemoradiotherapy, and were included in the analysis. 54% had open surgery and 46% had MIS. Overall, the MIS cohort was 76.3% laparoscopic and 23.7% robotic. MIS significantly increased from 2010 to 2016, seen here. MIS was dominant for the first time in 2014. Robotics demonstrated a steady annual increase across the study period. In multivariate analysis, Asian Indian race, metropolitan region, and academic/NCI designated and COC accredited cancer centers were all more likely to use MIS. The Midwest and southern regions of the U.S. were less likely to use MIS. MIS continues to be underutilized for rectal cancer in the elderly. Less than half of curative resections were performed through an MIS approach overall, and, despite steady robotic growth, only 61% in the most recent year. Racial, geographic, and facility factors, including proximity to COC-designated centers, impacted MIS use. Further work on regionalization and ensuring MIS access and training is available in all geographical locations could improve surgical quality and outcomes in the elderly.